Geneva, the United States on Wednesday hit back at a UN women's rights panel that said some US states limited access to abortions during the COVID-19 pandemic, rejecting its interference and the notion of an assumed right to abortion. The United States is disappointed by and categorically rejects this transparent attempt to take advantage of the COVID-19 pandemic to assert the existence of such a right, the US mission in Geneva said in a release posted on Twitter. This is a perversion of the human rights system and the founding principles of the United Nations, it said, citing an August 11 letter it sent to the union experts responding to the spurious allegations. The Union Working Group on Discrimination Against Women and Girls said on May 27 that some US states appear to be manipulating the COVID-19 crisis to curb access to essential abortion care.
The panel of 5 independent union experts said that states including Texas, Oklahoma, Alabama, Iowa, Ohio, Arkansas, Louisiana and Tennessee had issued COVID-19 emergency orders suspending procedures not deemed immediately medically necessary to restrict access to abortion.
This situation is also the latest example illustrating a pattern of restrictions and retrogressions in access to legal abortion care across the country, Elizabeth Broderick, panel vice chair, said at the time. The US statement cited allegations of forced abortions and sterilizations in China's western region of Xinjiang and urged the panel to focus on actual human rights abuses. A lack of comment on such issues was one of the reasons that the United States and others increasingly see the UN's human rights system as utterly broken. As President Donald Trump, seeking re-election in November, works closely with evangelical Christians and puts their causes of restricting abortion and preserving gun ownership at the top of his policy agenda.